Okay, we're gonna go ahead and cover the anterior deltoid for some trigger point work, and I'm gonna be working on Kristen here. So like I said, the muscle is the anterior deltoid. The origin point is the distal 1/3 of the clavicle. The insertion point is on the deltoid tuberosity of the humerus, and we're just gonna lengthen those two areas. The patient position is patient laying on their back, so go ahead and lay on your back. When we're having them lay on the back too, I want her shoulder all the way where it's basically off the table. That way we can exaggerate the stretch that we're performing here. And then, like I was talking about before, that origin point is that distal 1/3 of the clavicle here, and the insertion point is the deltoid tuberosity. So we want to lengthen the point in between these. That way we can put the muscle on full stretch. So I am going to go ahead and get her in the proper position here. So as you can see, she's palm up. This is external rotation. We want her in extension of the shoulder, pretty much as she can tolerate. And then also, its other primary function is adduction of the shoulder. So we want her in a little bit of abduction. So once I get into this position here, I would also have the table at a higher height, but for the sake of this video, I'm just gonna be kneeling here. And I'm going to be working along the full length of this muscle here. And Kristen can definitely feel some of the intensity of this stretch. And more of the time, I find some of the trigger points a little bit higher near the anterior shoulder capsule here in this area, but I will also find some trigger points along the middle portion of this, but less commonly I find them down near the insertion site for this muscle. And then I can actively and passively move the shoulder here, so I can ease off the stretch by putting it here, find an area that I want to work, like right here on the anterior deltoid, and then push her into a little bit more extension, and she can feel how that intensifies the stretch. So this would be more of a passive way to work on the patient. If I need to work on the patient with both thumbs, for example, I can have her actively reach backward, keeping that palm up towards the ceiling, excuse me. So she can reach back as far as she needs to. I can work here with both of my thumbs at the same time. That will just add to the intensity of the technique. And this is going to be your most common area that you're going to have problems with people with the shoulder. All right, perfect.